Welcome to Coffee Talks about collaborative dental hygiene practice in community settings. Hi Claire, I'm glad we could meet to have coffee and talk about collaborative dental hygiene practice. I know over the years we have informally met to do the same thing to help move the model forward. But today our goal is to have our first coffee talk and speak to our colleagues to give them information so hopefully we can improve the number of dental hygienists and dentists who partake in this model and bring more access to care in non-traditional settings. We need to talk about what works and how it works and answer some of those questions that we've fielded over the years.
That's right, there's a lot to talk about. So let's start by going back to the basics for our viewers. How do you define collaborative dental hygiene practice?
Well, it's an opportunity to bring dental hygiene services to people who don't have access to oral health services, to bring it into their communities, or in other words, to provide dental hygiene services out of the traditional dental model and go to where people live and learn and work so that they too can have care. I have not had a collaborative practice, but I've supervised a few dental hygienists who have had a collaborative practice agreement, which is required by law. And I've also written several collaborative practice agreements. I think it's really important to understand this through the eyes of an oral health advocate, and also I've been an educator for a really long time. So I hope I can shed some light on some of these problems and issues we have with this model.
And for myself as well, I have personally never worked under a collaborative agreement or in a collaborative agreement setting, but I have been heavily involved with calibration of dental hygienists who do, and also in promotion of dental hygienists to be able to do oral screenings and provide early preventive care for Minnesota's Head Start children a number of years ago. And I also have quite a lot of experience working with clinicians who practice in school-based dental sealant programs. So both of those scenarios require the dental hygienist to have a collaborative agreement. And this all started back in 2001. Hard to believe that it's been 17 years already since we first started talking about this. A small group of eager colleagues and both dental and non-dental alike got together and advocated for expansion of Minnesota's dental laws and practices, and that's what led us to collaborative dental hygiene practice. So over the years, a lot of questions have come up on how do I implement this? What is required? Are there financial issues that I should be working around? What are the scope of practice protocols? And I know we'll talk about a lot of that. There was confusion from early on between dental hygienists and dentists who tried to compare the collaborative dental hygiene public health model to dental hygiene services provided in traditional dental hygiene settings or in dental practice settings. Collaborative agreements were never meant to authorize dental hygiene protocols in traditional dental practice settings. So I hope we can clear that up. So between that and the confusion, we'll try to make it easier for dental hygienists, dentists, and dental assistants to successfully engage in this practice model. To start with, we probably should talk about regulations that surround the model.
I think that's a good place to start. It's very complex, but I think we need to rely on the statutory language, the Minnesota law that created this model. And I do need to mention that it's easy to look it up, although it's on the website as well, but it's Minnesota Chapter 158.10. And in it are the provisions that are mandated by law that need to be included in a written agreement, as well as how the model functions in practice. Since 2001, you mentioned it's been 17 years, we've had some real positive iterations of the law and additions in scope of practice. And those can also be followed on the 21st Century Dental Team website. You can see the changes that were added along the way to improve the provision of care in those settings. It specifies the settings that are required to be qualified for this type of model, and those would be healthcare facilities, programs, or nonprofit organizations. It goes on to further define those settings. So another thing to look up to be sure that the practice that you're in, the location that you're in, is satisfying the law. In addition, there are requirements for protocols. Specifically, we'll talk about those two later on. Practice protocols, the roles of the dental hygienist and the dentist, record keeping, referrals, consent, scope of practice, and so on. There are a lot of unanswered questions. The law doesn't give us enough information. We have no rules currently that describe the law. So if we have unanswered questions or they're gray areas, we go to specific entities for those answers, one of which is the Minnesota Board of Dentistry.
So Jean, what sort of questions are you typically asked?
Well, I'm sure you've been asked the same questions. They tend to repeat themselves, but how do I get a collaborative practice agreement? Where do I get one? What is it? How do I get started? And that's the tough part. We aren't natural entrepreneurs, most of us, and neither are our students. So we'll talk more about our obligation to prepare students better in the future. How does reimbursement work? You know, what gets reimbursed, what doesn't? Some of the business side of this model is what's important to give information about. The dentists aren't on site and oftentimes never on site. How do services get authorized? How do I function? What protocols do I have to follow? The law does not tell us all these things, and there are no rules currently that also explain the law further. So again, we have to rely on other entities like the Board of Dentistry to help us answer those gray areas and those hard questions. I would also highly recommend that we connect with other hygienists that currently have collaborative practice agreements and function in those settings. We have a lot to learn from them, so I would highly recommend that.
And we're also fortunate to have the Normandale Community College website that gives you a timeline of growth from 2001. The website provides news. You can go to it to find upcoming events and find a huge number of resources around collaborative dental hygiene practice for that, what we're calling the 21st century dental team. So that really gets us started. And we'd like to include the viewers, so we invite you to submit your comments and questions to us. So grab your cup of coffee and come on back and join us for our next coffee talk.